Alright, knock, knock, knock. I performed my hand hygiene. Alright, so hi Betsy. I'm Emily. I'm a student nurse and an LPN. And hi, Betsy's daughter. I'm also a student nurse and LPN. I know you have the condition glaucoma. I know it's chronic, progressive, and irreversible, so you may seem a little hopeless right now, but good news is we have medications that can help alleviate some of the symptoms. So, what kind of symptoms have you been experiencing? Oh, well, I've been experiencing some blurry vision, tunnel vision, and actually, I don't really experience too much besides that. Alright, well, okay, neat. This will definitely help with that to alleviate some of the symptoms. Do you know why this happens? I have no idea. Alright, well basically, there's a lot of fluid in your eye, and one of them just isn't being drained out properly. Oh no! I know, but this is common and that's okay, which is why we have these medications to help alleviate those symptoms, okay? Oh, okay, good. Alright, and then your daughter's here too, so if you ever need help administering them at home, she can help you too, okay? So, this is the Lantipros. So, the whole goal of this medication is to help drain out that fluid and give your eyes and all that pressure in it a little bit of a break, okay? Sounds good to me. Alright, awesome. Does that make sense to you, Betsy's daughter? Yeah, it sounds great. Okay, great. Alright, so I'm going to explain this medication, okay? So besides draining it, there may be some side effects. Oh no. Exactly. However, these side effects are actually pretty mild and pretty cool. Oh really? What are they? Okay. Well, some of the medications that or some of the side effects this medication may give you are maybe blurry vision. Oh no. Your eyes actually might change color, like the pigment of it or the color may become more brown than usual. But a cool one is long eyelashes. I wish I had long eyelashes. A lot of other patients I see get these beautiful, lush eyelashes. Oh my goodness, that sounds great. And how does that sound to you, Betsy's daughter? Yep, that sounds fine. Okay, so just a key point with this, a lot of people with glaucoma get two medications via eye drop at the same time. Yes. So if this happens, and say a nurse is just having a busy day and can't remember, just be sure to remind them, and Betsy also at home, or Betsy's daughter also at home, be sure to remember that you need to space these medications out by about a minute. So a great way of doing this is saying, sure, I'll take my eye drops now, then take your oral medications, and then you can take your second dose. Well, why can't I just have them at the same time? Well, you can't have them at the same time because if you have them at the same time, that first one will end up washing away all of the second drop will end up washing away all of the good stuff the first one's supposed to do. Oh, okay, does that make sense? Betsy's daughter, does that make sense? Yes, totally, I understand. Okay, so could both of you really quickly repeat back what I said, because it's really important about this medication. Betsy's daughter first. So if I give my mom her eye drops at home, I need to wait a minute between each one. And a way I could do this is by giving her her meds and then coming back and giving her this. Perfect. How about you, Betsy? What do you tell a nurse who's just trying to rush and give you these eye drops? I'm going to say, hey, nurse, wait. I need these spaced apart by a minute. A very smart nurse told me that. Alright, perfect. You guys know what you're doing. Thank you for listening to me. Alright, and then really quick, I'm just going to show you how these are to be administered. So for you, Betsy's daughter, if you don't have a pair of gloves, that's okay, they're preferred, but we got to make sure to perform our hand hygiene. Before this, I already did my med checks. No allergies, this is safe to give. I already used this computer in the MAR and everything, so we're going to skip that for the sake of time. Okay? So anyways, when I do this, I have my gloves on. I did my hand hygiene, I have my gloves on. I am going to stand on my I'm going to use my non-dominant hand here, and my dominant hand's going to be holding the drops, okay? So I'm going to pull this down, and there's this funny little thing called the conjunctiva, which is like a sac. Betsy's daughter, if you could see this little sac here, that makes sense. And Betsy, you have pretty big corneas, so this will be easy for your daughter to distinguish from, and a lot of other nurses who already know this procedure. So if you're administering it by your daughter, just remember it's not going in this big white space, it's going in the little space underneath it, okay? Same if you're trying to administer them at home, Betsy. Remember, it's not going in your big white part, it's going in this little sac beneath it, okay? So we're gonna just hold it here with your dominant hand, pull down a little, hold about a 1/2 inch to 3/4 of an inch, and do the amount of drops prescribed, okay? And then after that, to prevent the medication from going into the rest of the body, we're gonna actually press down right where this meets, and then Betsy's daughter, it would be right about here, where it meets right before the nose and turns and the eye kind of ends. We're gonna press and hold that down for a minute. Why would I do that? Well, you're gonna do that so it doesn't cause any other systemic effects that maybe could happen, or so that it doesn't start leaking everywhere, okay? And then afterwards, you're all set. All right, so I'm gonna perform my hand hygiene, and I'm going to head out. We'll follow up with some patient teaching, and I have a pamphlet for you guys. If you have any questions, let me know.